And now on the line is Breda Gahan, the Global HIV and AIDS Programme Advisor at Concern Worldwide. Breda, welcome to the programme.
Thank you very much, Darren, and thanks again for your interest in the HIV response globally and in Concern's work. Much appreciated.
Okay, that's grand, yeah. Breda, this is our first interview in about 10 months. Could you fill us in on the main things you have been doing in your work over the last 10 months?
Well, yes, Darren, as well as HIV in my portfolio, as you know, I'm a nurse midwife, firstly, and still registered here in Ireland. So I'm the team lead for health and HIV. And in terms of my health work, the earlier part of the year was supporting in terms of technical assistance to our EU-funded health programs in Sudan with the people affected by the conflict in West Darfur, refugees, internally displaced, and host populations. And we also have 2 EU-funded programs in Bangladesh with the urban extreme poor slum dwellers, squatters and pavement dwellers in the cities of Dhaka, Chittagong and Mymensingh. So it really has been supporting health system strengthening efforts there with our concerned teams and partners in Sudan and Bangladesh. And I'm due to go back to Bangladesh in about 3 weeks' time to do a midterm review of that current program. And HIV is integrated in terms of awareness raising, education, feedback from the Amsterdam AIDS conference when I go probably to Sudan in January 2019, as that's still a very important issue. And probably you know today, Darren, that 40 years following the primary healthcare declaration, Alma-Ata, in Kazakhstan in 1978. Is that right? Yeah, 40 years. They're meeting today in Astana, it's now called, to recommit to the Declaration on Primary Healthcare to support delivery of universal healthcare and towards the Sustainable Development Goals, particularly SDG 3.
And it's interesting to talk about primary healthcare because it's only really in the last few years that we in Ireland are kind of getting these primary healthcare centres, isn't it?
Exactly, and I was very surprised when I first learned myself about primary healthcare when I joined Concern working in Sudan in 1988. Imagine it's 30 years ago. I learned about primary healthcare there for the first time, about the Alma-Ata Declaration, about the 10 components, and it's amazing. Even then I thought, gosh, this is what countries, including Ireland, the USA, the UK, Europe, all countries need to invest in and commit to primary healthcare to support health protection as well as treating illnesses. Sometimes I say in Ireland we don't have a healthcare system, we have a sickness care system. You enter the system when you're sick. But primary healthcare is all about particularly promoting and protecting health and prevention of illnesses, including Ebola, polio and HIV. Which to me absolutely fits under primary healthcare. And I think 2 of the most important elements of primary healthcare that haven't really been afforded enough support, particularly mental health and dental health. I mean, mental health is increasingly important in Europe, northern countries, and in southern countries where people are affected by migration, conflict, economic distress, rights of women. I mean, now more than ever, primary health care is relevant. Protecting health. It's, a national asset. We can all remember what, sadly, the impact of Ebola had on Sierra Leone and Liberia a few years back. And now look, currently today in Eastern Congo, it's still not contained. The Ebola outbreak, although it's not making headline news, is still ongoing, and the people who are supporting on the ground deserve huge commitment and support for trying to stop transmission of Ebola, which is even more challenging, I would say, than HIV in terms of fear and stigma and discrimination. But all of the elements of primary health care are as important now as they were in 1978.
And the biggest diseases kind of facing people in developing countries would be AIDS, TB, malaria, and I think polio is pretty much gone now. Is it those 3 or 4 illnesses? Is it that are the big kind of 3 or 4 like?
Yes, malaria, fever. What was the second one you said there?
TB.
TB, often with HIV, diarrhea diseases. I mean, there are up to 10, 12 cholera outbreaks ongoing on the African continent due to lack of access to clean water and safe sanitation. These are the big illnesses in terms of infectious diseases. But there is a growth of what they call NCDs, non-communicable diseases, heart disease, cancer, blood pressure, hypertension, in both poorer and wealthier countries due to lifestyle changes and more sedentary lifestyles, more processed and richer foods, not to match our, more sedentary activity. I'm sitting here at my desk talking to you. And there is a great program of work that needs to be delivered, I would say, under the primary healthcare program in terms of health protection so that young people, especially from a childhood age, don't develop infectious or non-communicable diseases that are increasingly killing people in Africa, Asia, and in Europe and the USA.
Okay, we'll move on to talking about HIV and AIDS because I understand there were 3 conferences on recently over the last couple of months that you attended. To compare it now to when we did our last interview 10 months ago, can you tell me if there are any big things you have learned in the fight against HIV and AIDS since that interview?
Well, at the Irish Aid, Irish Forum for Global Health supported feedback session, it was noted that actually Professor Lambert from the Mater Hospital, that there hasn't been huge new science recently. Progress is being made in the types of treatment being delivered for the people who know their status and have been tested and can access treatment. But there's been no huge new news in terms of vaccine or a cure. That's the reality. And the atmosphere, I would say, in Amsterdam this year at the end of July, because the Netherlands is very good on sexual reproductive health education in the country. They have reached their targets. It was quite sanitized compared to the energy of the conference 2 years previously in Durban in South Africa, where the epidemic is still very high, increasing in certain, especially poorest communities and the extreme poor, the populations that concern works with. The Lancet, the medical journal, released a report the day before I went to the conference at the end of July, and it was sobering reading. In fact, it said that the world is not on track to end AIDS by 2030. And they also said that the greatest mistake made by the AIDS community was to talk about the end of AIDS message. It's not near the end for people who are infected and know their status and can't access treatment. 41% of people who are not on antiretroviral medication. And it's certainly not on track in terms of, 5,000 new infections per day globally. That is still a staggering number. And I was just checking the Irish data for this week. It's week 42. And in Ireland, up until this year, Wednesday, the report came out yesterday, 416 newly diagnosed HIV infections in Ireland this year. So, it's still an issue in terms of, I would say, complacency, lack of attention, lack of information, education to support safer behaviours and practices that can prevent transmission. Concern with our Douglas partners, with Irish Aid, remain committed, and I'm glad I heard our Director General of Irish Aid speaking yesterday about the new Irish Aid White Paper, and we've been advocating that health and HIV remain strong in terms of Irish Aid's commitment in countries overseas going forward. AIDS is not over, and a lot more needs to be done to halt the epidemic, both here in Ireland Eastern Europe and Central Asia currently has the fastest growing epidemic, and certainly in the poorest 20 countries you mentioned there, in mostly in East, Central and Southern Africa.
Are you saying that 41% of people around the world who have HIV or AIDS are aware they have it, and they just can't, there's no service for them to go to, like?
At the minute, nearly 22 million people, about 60% of people who know they're living with the virus are on treatment. 41% who either know their infection status or who've never been tested are not on antiretroviral therapy. So it's 60-40. And the sad thing is that in many countries, people have never been tested and don't know their status. And many of them have said to me, well, why would I get tested? Because even if I do know my status, I'll be even more sad because I know treatment is not going to reach me in my remote village far from the capital city. Health systems need strengthening to be able to support safe delivery of antiretroviral medication. And the good thing was I was at the pre-conference in Amsterdam in terms of the nursing pre-conference, ANAC, the Association of Nurses in AIDS Care. And I think you know, Darren, that I worked in St. James's Hospital here in Ireland on the oncology, hematology, HIV and AIDS unit before I joined Concern in 1988. And we can do a lot more. I'm still registered in Ireland as a nurse and as a midwife. And nurses can do a lot more to be able to support the delivery of primary health care, including antiretroviral medication, in less developed countries if they're trained and supported to do so. Nurses are very influential in terms of public policy. I saw that at the AIDS conference in Durban in 2016. So, you know, we need to have more people engaged in safely delivering the treatments, but also advocating and supporting people who are afraid to get tested so they do know their status, so they can get on antiretroviral medication, and then they're not infectious in terms of passing the virus on to other people. I mean, every week, you know, 7,000, in terms of young people, the fastest growing, especially young women, every week, around 7,000 young women between 15 and 24 are newly infected with HIV. That's staggering. 7,000 a week. And even Ireland, 416 this year alone until now. That's a lot of people in a room. And they need testing, treatment and support for life. So it's really important that the message of test and treat reaches those who need it most. And it's better delivered through, I would say, a primary healthcare system, not as a standalone, separate service. Even in St. James's, they changed the name to the Guide Clinic because of the stigma and discrimination still surrounding HIV and AIDS.
What's it called? The Guide Clinic, is it?
In St. James's, they call it the Guide Clinic.
Okay. G-U-I-D-E, is it?
G-U-I-D-E.
Yeah, okay.
Okay. Yeah. You know, it's genitourinary infection disease.
Okay.
I can't think of the last word, but it's GUID, the Guide Clinic. And, you know, many people now are advocating for home testing, which I support with reservation, as long as people are counselled in advance and prepared for the result they might receive. Because if you're a young man or a young woman in Afghanistan or, say, Malawi, your circumstances might be very different if you found out that you're HIV positive. Your family might not support you, your workmates. You know, even in Ireland, people increasingly are keeping it private, and it is their right to keep it private. But it doesn't help in terms of highlighting the fact that AIDS is still here. It hasn't gone away. AIDS is not over.
Yeah, I read a tweet from UNAIDS yesterday that said that 80% of the people with HIV and AIDS around the world live in just 20 countries. I suppose it's good that we can identify where on a national level most of the people who are not on treatment are living, yeah?
Yes, because then we can better target where the investments need to be made in terms of reaching out to those who haven't been tested, don't know their status, and to support the health strengthening of the health systems in those countries to be able to safely test, treat, support and care for those living with HIV and people directly affected. I mean, everybody, is aware that almost 37 million people globally are living with HIV. But for every one of those persons, including people in Ireland, about 10 are directly affected. I would say it's 370 million directly affected. A mother, a father, a brother, a sister, a co-worker, a cousin, a teammate, a friend. So it's not just people living with HIV, and especially in poor families where it might be a father or a mother, it can affect productivity, food security and livelihoods, because opportunistic infections affect those who are poorest. I've always said that food is the first medicine. You need good food, a good diet to be able to absorb and make the ARVs work most efficiently and effectively. And as we know, hunger and HIV are very bad bedfellows. In some countries, hunger will drive women to take risk in terms of unprotected sex because they want to get food on the table to feed their children. So education for protection and prevention is very important. And thankfully, Irish Aid, I don't know if you know, but this year marks World AIDS Day on December 1st. It's 30 years since World AIDS Day was first declared as a day of international health importance. It was the first World Health Day in 1988. 30 years this year. And the theme this year is Know Your Status. To help people to know their status. And Irish Aid, with Concern, Docus HIV Working Group, Irish Forum for Global Health will be supporting the Father Michael Kelly Lecture on December the 11th.
Okay. We talked there about 20 countries where 80% of the people living with HIV around the world are living in 20 countries. The problem is that, isn't it, that most of these countries are just so big and they're so, a lot of the areas are so remote. It's very hard to kind of get to with treatment. So that's a big, huge problem. Yeah.
Access and supporting the countries most in need, can sometimes demand a lot of resources, and new infections are more likely to occur where there's high risk and vulnerability to poverty, and especially extreme poverty, which is Concern's target in terms of reducing in the worst impoverished countries. Also, leadership can be absent, and it's a long time since I've heard presidents speaking out about leading on the response compared to what they did 10 or 15 years ago. I mean, the largest epidemics are still in countries where there's also disruption and conflict. Cote d'Ivoire, Ethiopia, Nigeria, South Africa, Zambia and Zimbabwe are more calm, but Zimbabwe has had upsurge in internal strife as well. And in countries like this, the health system is less likely to be functioning effectively, which means there aren't people there to test. Antiretrovirals might not be reaching. Sometimes PEPFAR and the Global Fund are less likely to engage if governments aren't supportive and leading in terms of at least trying to get the treatment to the people who most need it. So a lot of the work is based on advocacy, and supporting people who are living with HIV in those countries to be able to stand up and say, listen, everybody has a right to testing, treatment, and treatment for life. Health is a right. But the HIV and health funding has more or less remained flatlined in the last 4 or 5 years. People are not investing. I do wonder now how much investment will increase in terms of primary health care. Because without investment, we won't be able to deliver on SDG 3 by halting the spread of HIV by 2030.
The Prime Minister of India said a year or two ago that all people living in India who have HIV are going to get free treatment. This is great news, isn't it?
Absolutely. If the leadership in the country is on board supporting the response, then the donors are more likely to be available and to help, including Irish Aid and other bilateral donors in the countries where concern is working. Leadership is the most critical ingredient. If people speak out, then poor people are less likely to be ashamed and shy, and the stigma and discrimination is somehow abated. But the complacency over the last 4 or 5 years is quite shocking, I would say. And we won't get to zero new infections, zero discrimination, zero AIDS-related deaths, unless, as the Lancet journal said, we need to get back on track. HIV is being left behind. We're working on delivering together with our colleagues in Irish Aid, DOCUS, Concern, the SDGs, locally and globally. But unless we work together, this will not be realised by 2020, 2030. And everybody would argue that, it's important now to integrate the HIV response into the broader health system strengthening response. And it's more efficient. So primary healthcare is essential. And young people are getting more vocal. Yeah, in India, I saw there's a program called Champion in Me. One campaign I heard about in Amsterdam is chase the virus, not people living with HIV. But the people being left behind are the ones who are least likely to speak out in terms of accessing their right to treatment and prevention. And that really hasn't changed. People living with HIV, a young woman, a prisoner, a migrant, the migration crisis currently, injecting drug users are criminalized in many countries, sex workers, men who have sex with men, transgender women, pregnant women, again, often find out when they go for antenatal care. They might not have suspected they were HIV positive. That's why women often know before men of the same age. Thankfully, mother-to-child transmission is reducing, and that's the biggest success story. It needs to be amplified, vocalized loudly. We do know how to prevent mother-to-child transmission. And a HIV-positive mother can deliver a HIV-negative baby. We can do it in Ireland. We can do it in the countries in which we work if the health system is supported to do it. And that's why Concern has been especially investing in programs through EU and Irish Aid funding and DFID, Comic Relief, where health system strengthening is an intended outcome for better health coverage of all the services. Displaced people are being left behind also. If you're deaf or blind, you're less likely to know that you might need to take a test, where to get a test, and if you're found to be positive, what to do with it. Displaced people, and increasingly older people forget that you can still be vulnerable and contract HIV over 50. But in all the 12 UNAIDS population groups, I would still argue that it's the extreme poor people living with HIV and affected who are being left behind, and especially women and young people. And we need to support the activists and young people who are speaking out. ACT UP here in Dublin, Ireland, is doing a very good job, at least locally, and they have a global campaign. I think it needs to reactivate everywhere. Because for people who are living positively, and thankfully they're not getting sick, they're not exposed to other infections like TB or malaria or diarrhea diseases in Ireland, they don't see much need to speak out. But ACT UP, I think, needs to be revitalised to speak out for the voiceless and the extreme poor who can't speak for themselves. Coming up to 30 years of World AIDS Day, people will only act on the theme, know your status, if they know that once they're diagnosed, if they're positive, they can get treatment for life. Or if they're found to be HIV negative, hopefully, people are supported in social behaviour change to stay HIV negative. Prevention is still best. And in Africa and a lot of the countries you mentioned, with conflict and other issues, HIV isn't on the mind of people every day because it's not like Ebola, it's not immediate, it's not like cholera. It's a slow emerging virus in a person's body. They might not see anything unusual for a long time. They might think it was diarrhea disease or malaria or TB or a cancer. So it's really important to support accurate education, and it really needs to start in primary school at 10, 12, 14 years of age in an age-appropriate way.
Mm.
People have a right to accurate information to protect their lives. Because in so many countries where concern is working, especially among the extreme poor, they never get to secondary school. So if there's no support in the primary education system, it's not going to be successful in helping them to protect themselves. And, these are the most vulnerable young people, the people who enter the work, informal labour, either in cities or on farms at 15 and 16. And they often don't have the power to say no and protect themselves. So it's when leaders speak out, it's critical. But I know we have a problem going forward in that the next International AIDS Conference is supposed to be in the USA, in California. Well, many of the key people won't be able to get visas there under the current administration. And again, it's in a northern country. I believe it would be better in a country closer to the epicenter of the epidemic in East Central or Southern Africa. It was in South Africa in 2016. Why not have it in North Africa, in Ethiopia or Kenya? Surely could host the conference and put the spotlight where the epidemic is affecting most people.
Okay. Breda, how much more funding is needed so that everyone who has HIV around the world can be on treatment?
Well, I've the UNAIDS page open here in respect to the 20 countries, and the headline is a 10 billion shortfall for the AIDS response,
Right.
And the response has been flatlining over the last number of years. So, but national governments need to be supported through their developing taxation systems to be able to also invest in their health systems and to be able to help them stop AIDS. But the headline here is a 10 billion shortfall for the AIDS response going forward.
And 10 billion, it isn't like $1 trillion or anything like that. I think it would be achievable if people were governments were committed, wouldn't it? But particularly rich countries as well. Do you think?
Well, absolutely. When we think of the amount of money spent on arms and conflict and war and oil and travel, 10 billion is a very small amount of money. When it's divided among the richer and less rich countries, if everybody made their fair contribution based on ability to pay and income standards.
I've talked to you over in our interviews over the last few years about sub-Saharan Africa a lot, and the millions of people living there who have HIV or AIDS and who are not on treatment. I think you've already told us a bit about this already today, but could you give us more of an indication as to how things are going in the countries in general where you work in concern? You work in 20 countries, I think, isn't it?
Yeah, 25 countries now.
Right.
Well, it all does depend on the robustness or not of the health system in the country. Like South Sudan, it's very weak at the minute due to years of conflict now post the separation from the Republic of Sudan. I would say it's one of the countries I'm most worried about, even though it's not named here specifically on the UNAIDS pages. But all the risk and vulnerability is there in terms of conflict, violence, sexual violence against women, gender inequality, and people surviving to make a living. The health systems just aren't there to be able to test and treat people at the minute. So especially in the countries of conflict, Central African Republic, where else at the minute is suffering the effects of war, Cameroon, even though concern doesn't work in Cameroon. Any of the countries that are affected by conflict are most at risk in Africa. DRC, I mean, goodness, Ebola is already there. So where the health system is failing, fragile, HIV will thrive more easily. That's the sad fact. That's the sad
It's
fact.
true to say that funding is it true to say that funding is the biggest issue? It needs to be addressed, but there are other issues as well, like resources and all. I think you already mentioned that already.
Funding and leadership is, I would say, the critical ingredient. And then paying, the frontline health workers to be able to do their job in terms of counselling, supporting people to get tested. If they get tested and found they're positive, to stay on treatment, compliance. It's a chronic illness for life if you're found to be positive, like diabetes or epilepsy. It needs management until you're old, until your last days. That's the problem with HIV. Even some cancers can be cured. TB increasingly. Malaria, obviously, although there's still high mortality from both malaria and TB in the poorest countries where concern is working. But it's a huge burden in terms of the health budget in poor countries. So the best absolutely is to prevent new infections. Turn off the tap. And it's great that Darren, you and your listeners, this is Near FM, did you say?
Yeah.
Are interested and can support the response. But even if people don't have money to give, voice is equally important. Reach out and speak out.